मिली घोष presents डॉक्टर्स के साथ सवाल जवाब. Hi friends, today we have Dr. Vijay Langer and welcome to our show, sir. So if you can tell us about hair transplant, like what is it all about?
Hi Millie, thanks very much for having me over. So hair transplant is a very safe and painless procedure which is done to boost the self-confidence, usually males but sometimes also for females, wherein we place hair from usually the back of the head and the beard area to be planted over the areas which have lost the hair. Indeed, it boosts the self-esteem and self-confidence in the patient and definitely makes him or her look more youthful.
Dr. Langer, if you can also tell us how is this procedure performed?
Well, a hair transplant is very convincingly and very effectively done or performed under local anesthesia. It is very effective local anesthesia, and wherein the hair grafts are taken from. There are essentially two types of procedures which are done. This is the follicular unit transplant and follicular unit extraction. In follicular unit transplant, we take a strip of the skin and cut out the hair from the strip. The resultant wound is sutured in a way that it usually does not. We try for it not to show by what is called as a trichophytic closure, but I really don't like that the resultant scar, because it definitely does show if the hair is short, and therefore it shows as a branded scar. I quite like the other type, which is the follicular unit extraction, wherein the hair grafts are taken, single hair follicles, one after the other, is taken from the back of the head, from the beard, and sometimes from the chest, and they are planted over the areas which are devoid of hair by making slits, and then we place them one after the other. And it is a very effective procedure. It is all done under local anesthesia, and it is quite safe and painless.
Dr. Langer, is this procedure painful? And how long does it take to see some visible results?
So the answer to this question is no, the procedure is not painful at all. In fact, it is completely painless when it is done by committed and experienced hair transplant team such as ours. We take immense pride in allowing the patient to be operated the safest and the most painless manner, and usually my patients sleep during the surgery. That is the effect of the local anesthesia. Bad press does come into this procedure when it is done by teams which are not really committed or do not take good care of the local anesthetic preparation. And indeed, we hear a lot of stories where such procedures are done in a painful manner, and it is unfortunate when they do this. The results, usually the grafts which are placed drop off on their own by about 2 to 3 weeks, a maximum of 4 weeks, and the results, and then they re-sprout by 4 months. The final results for the front of the hair and the top of the head come in by 12 months or so. That means 1 year from the surgery, and for the crown area it might even take 15 to 18 months.
Dr. Vijay Langer, are there any complications from the surgery?
Like any surgery, it has its hair transplant has its own small set of complications, such as bleeding, local bleeding, and possible infection. Usually we do not see all these problems because the blood supply over the scalp and the face and neck is very robust and very profuse. So infection is almost non-existent, and we take precautions by giving the patients antibiotics. What definitely gives bad press to hair transplant is in the recent past, or well over the past few years, we've had some macabre incidents of actual deaths happening after hair transplant, and that is uncalled for and not warranted at all. I've already said it's such a safe and painless procedure, but if it is done under the auspices of and under the control and the control of a plastic surgeon or a dermatologist, as the National Medical Council has already passed a stricture that all other fly-by-night operators, or where the hair transplants are done by just technicians without any real knowledge of what they're doing wrong, especially because a lot of these some of these deaths have occurred due to poor sterilization and infection, as well as local anesthetic toxicity, wherein they've used a lot more local anesthetic than is actually warranted. Apart from that, there are hardly any complications from this surgery. Once again, I will reiterate, it is rather safe and painless surgery.
And so, is hair transplant a permanent solution for hair loss?
Yes, hair transplant is a permanent solution for hair loss and fall, and ideally it is for life, because the way the hair grafts are placed and from where they are placed, it is not subject to the hormonal changes. You have to have a very good hair transplant team and an experienced team such as ours. We get some very good results, as well as the patient has to take good care of the hair in general, and definitely ideally for life, but possibly for even 8 to 10, maybe 15 years is the longevity of a hair transplant.
And doctor, who will be the ideal candidate for hair transplant?
The ideal candidate for a hair transplant is any male or sometimes a lady with significant hair fall and loss, with gaps in the hair. When the gaps are quite less, then we can actually treat them with medical management, such as with gel, serum, PRP, that is platelet-rich plasma, or even growth factors, which are considered to be more sophisticated and more effective than platelet-rich plasma. But usually for gaps and for areas of hair loss where the hair is completely absent, it is definitely an indication for a hair transplant surgery. The ideal patient has to be well motivated and should not have any uncontrolled medical conditions such as hypertension, heart disease, maybe old heart attacks, or even uncontrolled diabetes. They should be all controlled medical conditions. They should be controlled first, and then only should the patient be taken up for a hair transplant. But otherwise, any patient especially with hair fall and loss, and especially loss of hair where there is no hair, is an ideal candidate for a hair transplant.